Hello everyone, this is Dr. João Alfredo Kleiner, veterinary ophthalmologist from Brazil, and today I'm going to show you a cataract surgery performed in a Bengal tiger. Main features of the procedure: the patient was a 2.5-year-old female Bengal tiger. Both eyes were done on the same day and a custom made IOL implanted. So this is what the positioning looks like. This is a dorsal recumbency. This is our endotracheal tube utilized to do the gas anesthesia with isoflurane, phaco unit, and this is our surgical microscope. Patient weight was 300 kilograms. So this is the port incision with a diamond blade of 1 millimeter, trypan blue, and this is the main incision, 3.2 millimeters incision. Viscoelastic into the anterior chamber. You can appreciate a little bit of hemorrhage all over the peripheral part of the iris. This is quite common in this species. Opening the anterior capsule to perform the catharact. So first you puncture with a needle and then increase with scissors, and then using the utrata forceps performing the catharact. Look how thin and elastic and delicate is the anterior capsule. So one should be very careful in order not to make radial tears. Quite a large capsular axis because of the big size of the lenses. Here doing the hydrodissection with BSS. The cortical part of the lenses is very jelly, so you can appreciate how easy it is to mobilize the nucleus. Emulsification being done. This is a standard phaco tip. Most of the part of the lenses is very jelly and easy to aspirate. Takes a long time to aspirate everything. And this is the central part of the nucleus, which is very hard. So we have to use both hands doing the stop and chop technique in order to fragmentate all this hard part. Takes a long time because the central part is very hard. So it's quite a unique feature in this species. So ultrasound power should be 60 to 65%. And this is the retinal image right after all the cataract material has been aspirated. So this is the custom made intraocular lenses. So the optic zone is 12 millimeters and the overall length is 21 millimeters. The diopter power is plus 30, and it is a acrylic hydrophilic foldable intraocular lenses. This is what the lenses looks like. So have it's a plate design with rings on the anterior surface of the lenses that improves the light diffraction, so you have a better image projecting on the retina. In order to implant the IOL, we have to increase the incision to 6 millimeters, like so, and use forceps for the implantation. Kind of a tricky because of the size of the lenses, so we have to do both hands in order to make sure that the lenses opens in the back. So centralizing the intraocular lenses, aspirating the viscoelastic used, and suturing the cornea with 9/0 nylon. So this is what the suture looks like. So this is a big incision, it's a 6 millimeters incision. So usually 3 to 4 stitches are good. And now we are doing a little bit of stroma edema using BSS and reinflating the anterior chamber. Right after the procedure, subconjunctival injection of betamethasone, 0.3 ml is used in order to prevent the post-op uveitis. So this is an image 3 days post-op. Hadassah was the name of the patient. She was being hand-fed with a baby bottle, and that's the way we train the tiger to accept the eye drops. So this is the owner here, and you can appreciate how calm the eyes are. And she was seeing pretty good 3 days after the procedure. So this is the surgical team. This is me. This is my wife Camille, and this is Dr. Livia. They was responsible for the tiger. The tiger is still under anesthesia. This is right after the procedure was done. This is another shot of the post-op. This is our anesthetist, Dr. Watanabe, another technician and the owner of the practice. Here we are doing a fundus exam with the clear view retinal camera right after the procedure. So this is the retinal image. So it's quite similar to a domestic cat fundus, and this is a quite nice view of a normal tiger retina. So those guys have a tapetal zone. This is the tapetal zone that reflects the light back and stimulates the retina again, so they can see better than us during night. This is 1 day before release from the isolation, so you can appreciate that the tiger is interacting with others. So we can appreciate the near vision and the far vision. Still using the eye drops. So this is testing the far vision. There's a guy on the roof there, and got a positive menace response. Was a quite awesome outcome. So trying to bite the owner just for fun. So this is for testing the near vision and the vision acuity. So playing with a little toy, just like we do in domestic cats. So I was very calm, no photophobia or important uveitis. quite active and respond very good to this surgical procedure. So this is it. I hope you all enjoyed. It was quite a reward for us to have been able to perform this complicated surgery in such a beautiful animal. This is very rare procedure in the world, and I invite you guys to log in my website and see much more about my work. Have a great day, everyone. Thanks.